Welcome to Follow Your Buyer Trailblazer Interviews. I'm Perry Rarick, your host and chief editor of Follow Your Buyer, a digital community for business leaders, marketers, and sales professionals in B2B market spaces. The purpose of our interview series is to share interesting discussions I have with trailblazing thought leaders. They're innovative, thought-provoking. They challenge the status quo. They embrace difficulty. They've served as vanguards for positive transformation, and they join me here to share what they've learned. Our trailblazer guest today is very exciting, Elliot Berger. He has a long history in the corporate world. He was a former chief marketing officer at Catalent. He had key roles at Johnson & Johnson. He spent several years with Ernst & Young, and that culminates now in a role now which is independent. He works as a fractional chief marketing officer, and he advises the life sciences industry as well as the investors in the life sciences industry. Welcome, Elliot, and thanks for joining me today.
Well, thank you. I'm glad you think I'm exciting. I should get more people to think that.
Of course, they just don't understand you enough. That's what it comes down to.
It's a pleasure to join you, my friend.
Good to have you. Well, I want to start out by, marketers love to talk about tactics, the creativity, and all of that stuff. I want to talk about certainly the art and science of marketing, but I want to talk a little bit about the upper levels of it, the higher level thinking, the strategic nature of that. And I know you just attended the JP Morgan Healthcare Conference. And so what are your thoughts? Are you coming back? Are you feeling optimistic, concerned, or maybe a little bit of both?
Yeah, it's been an interesting gathering. It is definitely more upbeat than I've seen it and that I felt in the last several years. I think the industry is in a good mood, if you would say. I think people came looking to make deals. People came with specific projects in mind. There wasn't the usual requisite amount of complaining about everything that the industry is prone to do in this space. The regulators and the financiers and the speed of it all and the prices on the market. Everybody seemed to be more upbeat than normal. And of course, the Novo acquisition of Catalent a couple of days ago has thrown some additional excitement into the waters and set the tongues wagging. So I think that the industry is in robust shape, I would believe. I don't tend to look at the industry at the very short term. This is a very long, slow-moving, perennial industry, if I might. You look at the pipelines, the future is already written on the pipeline, at least over the last 3 to 5 years, 7 years. Whatever is coming out is already in development, right? So the pipeline is robust. There are more modalities than ever, exciting cures and gene therapy, more small molecule products, more various new and upcoming technologies beyond that horizon, maybe T-cell receptor modality or microbiome or exosome, right? And the VC investment is more lively than it was before. And there's been a couple of well-received IPOs in the last couple of weeks. So ongoing level of record approvals and new medicines. So I think we're in good shape. It's not at the frothy heights it was a couple of years ago, which is probably good. It stabilized and moving forward.
So that's a lot of optimism, as if I'm taking that right. Any concerns?
Well, there's always concerns, right? The IPO window seems to be slightly open. It's not what it was. The VC funding is back, but not all the way back. Yeah. The CDMOs are in a bit of a transition, given how it was under COVID and all the rush and distortion that COVID created, and that needs to be normalized. Part of the Catalent saga, if you will. There's the delay, the dip that was generated by the VC slowdown among early development projects has got to work its way through the system for a couple of years. The interest rates are obviously very high, so the ability to finance both projects and CDMO expansions and equipment and all that's clearly much harder at 8% than it was at 4%.
Yeah.
The inflation is clearly, playing a little bit of a destabilizing role in different areas. So there's always a set of concerns, but I think on the balance, they are more, I would say, known factors that one can manage and work through versus COVID and some of these things that are very hard to predict and manage.
Yeah. So you mentioned the acquisition of Catalent by Novo Holdings, and so I would be remiss if I didn't ask you about that. So, being with you spent a dozen years with Catalent, so I want to ask you. So, if you were a chief marketing officer or chief commercial officer in a CDMO other than Catalent, okay, who did you talk to today, and what did you say to them about that?
Well, obviously, I would call all my salespeople, say, go call every single Catalent customer and shake the wagon, right? Every time there is a transition, no matter what kind of a transition it is, people get nervous, right?
Yeah.
Drug development is a risky business. There's no need to add other risks to the factors, so people get conservative and start saying, well, maybe I'll go somewhere else while it shakes out. We do that all the time with whatever negative news or changes that happen to competitors, particularly in this case, the three sites that Novo is taking over and will probably do some to prioritize their own business, at least going forward in development. And obviously they will honor all the contracts and produce everything they're contracted to produce. There's no need to panic or anything. But kind of over time, they will prioritize their products. And, to an extent, the GLP-1 boom has been a blessing to the industry because it's really helped smooth out the bust and sudden bust of all the COVID production, right? While people were predicting reasonably that the COVID boosting will take on perennial level of flu level type annual revaccinations, basically fallen off the map on political reasons or news or, the fact that everybody's had it or natural immunity, whatever that may be, the volume is gone. So the GLP volume has really been a blessing to a few other companies. Instead, slightly different companies, but pump some news into the industry. And obviously, it's helpful to the patients when properly taken.
Yeah.
So that's where Novo is looking. The interesting bit is going to be the remainder of Catalent, which is, almost 50 factories, including world-leading cell and gene factories and some of the world's best small molecule production facilities, as well as a top 3 clinical trial supply business, remain now with Novo Nordisk Holdings, which is an investment arm. And it'll be interesting to see what happens to that.
Yeah. Well, maybe we can catch up in 6 months to a year and we'll see where all that has worked itself out.
Absolutely. It'll be interesting to see if anything happens before that.
Yeah.
Obviously, they can keep it together. They can, Novo Holdings owns a number of other companies that are similar, including parts of, I believe, Evotech and Alpha Sciences and a couple of CROs.
Yeah.
So there may be interesting combinations or divestitures or so on. So that'd be an interesting space to watch.
Yeah. Excellent. So I won't press you for anything deeper than that. That's great advice, though. So I want to stay with this strategic thinking longer term in a marketing requirement, a marketing role. You have an interesting approach to life sciences economics. You have 3 key numbers you follow. Can you talk a little bit about that?
Yeah, well, strategy, I started my career as a strategy consultant. So I've always taken a very strategic approach to marketing because, if you don't know what your strategy is, you don't know what good marketing is, because good marketing isn't apparent by itself. It could be a very entertaining commercial, but if it doesn't do what it needs to do, it's just entertainment and waste of money.
Mm.
So strategy is really key and really important. So good that you stayed there. And look, life science economics, or particularly on the CDMO side, are all about volume, right? People ask me, well, what do you think about pricing? What do you think about pricing pressures? What do you think about breakthrough indications, rare, designations? And I always say, look, the thing in the industry, this industry moves on volume. The price what CDMOs charge aren't tremendously well correlated in most places with what the price of the medicine is. More correlated to how difficult it is to make and how much of it you're making. And the end of the era of blockbuster, where you need to make billion Lipitor tablets that people take for one or two a day for years and years and years, is gone. And everything is more rare, more orphan, and more expensive. And in fact, it's also sometimes curative as opposed to treatment, right? So you have to keep an eye on the volume of it. And what people outside the industry fail to recognize is it doesn't matter how many patients you're going to treat. The cost to develop a drug is very, very similar from a very large indication like cancer or heart or whatever to a very, very small genetic indication. So in the end, you have to amortize that cost over whatever number of patients you've got. And it's only a few thousand. You can do the math. The same billion or $2 billion, whatever number you take for development, amortized among 1 million patients over 20 years is one thing. Amortized over several hundred patients a year is a different thing. So I'm not surprised by the prices that are being charged. In fact, you have to amortize the cost of development, and you have to amortize the cost of all your failures, right? And as an industry, your successful products pay not only for the development and manufacturing and distribution of that product, it pays for all the R&D and all the running around you do on the 27 things that failed in order to make the one that you made, right? The failure rate from very beginning to very end is 90-95%. So these prices are a consequence, and if you want to cure diseases that are suffered by very few people, that's the price to pay. And when you cure much larger diseases, there's proportionately less per person because the math is the math, and you have to keep it in mind. In the end, the industry, has to deliver the patient prescription, no matter how many patients they are. And there's probably some room in improving efficiency in terms of particularly the new modalities to improve those economics. There's probably more room in improving efficiency in the approval processes and inspection processes between all these countries, I would think, than improving the efficacy of manufacturing, which there are some room for improving the efficacy of science, which is very difficult being science.
Yeah, really, I love how you simplify it. You just boil it down. We like to really complicate this process, but I like how you describe that. I want to shift gears a little bit to the relationship. You mentioned CDMOs. You have a lot of time, a lot of experience with Catalent. And I want to talk a little bit about the relationship between the drug sponsor and the service provider or the solution provider, the CDMOs, the CROs, and even consultants. So you had a clever way of describing how the drug sponsor feels about their drug and how that shapes the way they make a CDMO, how they apply the CDMO selection process. Can you talk a little bit about that?
Okay. Yeah, so, everybody tries to think about it, there's a B2B process, there's a scientific sale, it's very structured, scientific, and rigorous, and there's a, God help us all, procurement specialists who are, running this, and then multiple stakeholders and factual assessments, which is all true. However, the other thing that people need to remember is even scientists, even procurement guys, if they don't remember it often, are all human. So when you're talking about this new medicine that's being developed by the scientific team, and it's still a gleam in their eyes, and you're still just coming out with a eureka moment that I think I've got something, and then you start thinking about who can help you actually turn it into a real life medicine. It's a very long road from an interesting candidate to a real life medicine. I liken that thing, that process and that moment is, taking care of your baby, right? So you got a baby and you need to partner with somebody and you take them to your first kindergarten or preschool or daycare. And, no matter how many things you read and which checklist you're running, you don't like the teachers and you don't like the headmaster and you don't like the facilities or the food smells funny. You're not leaving the baby, right? It's your one chance to make $1 billion. It's your one chance to cure the world and help people and help patients. You will need to feel comfortable that whoever it is you're leaving that baby with will properly take care of it and help you raise it. And accordingly, I've always tried to market, and at some point I was also the head of customer excellence. But take care of customers from that perspective. We understand that it is your baby. We understand that that's your hope. We understand it's going to have a great chance of curing patients that need it. We're going to take care of it accordingly. And, if you look at the partners that are trusted to deliver brand new medicines to market, there's a handful.
Mm.
Everyone else, generic volume, secondary volume, backup volume, OTC volume, you name it. But the brand new launch, very few people that you would trust with your baby. So that's an important thing. Now, obviously, the big pharma sponsors think they know everything, and you may be allowed to help them, particularly on applied science sort of way, which is, I always promoted that CDMOs are experts in the applied sciences and the innovators and, the expert in science and breakthrough in biology, which helps. It's funny that you mentioned art and science. Our last marketing campaign at Catalent was about the art and science, and there was a big debate. No, it's all science. But there's an art to it. And the art is not in denying the science. The art is orchestrating and putting together all of the science and manufacturing and technology elements you need to succeed. And that comes from experience, that comes with processes, that comes from intuition, comes from a number of things, particularly newer modalities. And it's important. There's also an art and science to marketing, which we can talk about at a later stage. That's also important. People in this industry don't have the requisite appreciation of marketing, but there's definitely an art and science to that as well.
Yeah. So let's transition to that a little bit. And so I always talk about the buyer's journey and how complex that is. The drug sponsors, really doing their due diligence, and CDMOs, service providers, need to build trust through that process. But I think you mentioned, boy, you have to be really on your game to get their attention the first time. And you use the term, you have to be both good and relevant. What do you mean by that?
Well, so people always ask around in this industry, like, what is the most important factor that makes people select a service provider accordingly? What is it that you need to be marketing? And everybody goes around, or it's quality, or it's regulatory reputation, or compliance reputation, or your capacity. It is neither of those things in the beginning. Because the first question everybody always asks, can you help me solve the problem I've got? Right? Can you properly take my baby to the next step?
Yeah.
Right?
Yeah.
And this industry there's a million different challenges that are all very, very different, from CMC to gene therapy development to cell lines to you name it. So the first question everybody asks, or should be asking, is, can you help? So the first objective of marketing is to find the people that you believe you can help the best and that need what it is you are offering, where you have a competitive advantage, or at least a source of differentiation, or at least a fair shot. And make sure that they know that you are there to credibly help them. That you're credible, you're relevant, and you can help. And you have the experts, your applied science experts, that can help improve and address whatever problem they're having. And the other thing, then you got to be in there wherever they are, not wherever you want to be, all the conferences or whatever, wherever they are, and you're there frequently enough so they can remember that you can do it at the time when they need to have that partnership.
Mm.
Remember, it's a very slow-moving industry. If you're solving a problem that's required to be solved right before phase one, if they're still in discovery, they don't need you. If they just move to phase one and enter phase one, they don't need you. And then they don't need you for years. So you need to be there when they are needing you, and in order to at least make sure they remember, so they call you and give you that RFP or talk to you about.
Yeah.
And then the other, sorry, go ahead.
That's excellent. I love your pragmatic approach. You just simplify the complex. That's so key. But I cut you off there. What else were you going to say?
Well, so you got to get them in, and then the end, it's a combination of an emotional purchase process as we talked about. There's also a very objective purchasing process. So in order to remain on the list, you have to have quality and regulatory and all this other stuff that keeps you on the list. And then, whatever wins that, it's got to be the credibility of the brand, reputation of the brand, the emotional connection of the brand, and most importantly, your scientists or manufacturing people have to convince the customer to leave the baby. So you have to do your marketing in this bifurcated, trifurcated, you call it, way, where you first ensure that who knows about you comes. As I like to tell finance people, ROI in marketing is very hard. But the ROI of a customer that doesn't know you, it's very easy. It's zero.
Yeah.
So first you got to be able to, people know you and they come to you, and your awareness level is up, and your RFP levels are up, and your purchase intent levels are up, and your consideration set levels are up. And then, the strength of the brand. So when the sales team goes around, the guys go, not like, who are you? I don't know what you do.
Yeah.
But instead goes, oh, the Catalent guys are, yeah, I meant to talk to you about this. Yeah. I heard you guys are good.
Yeah.
So those things have to happen simultaneously. And good marketers can do one or the other. Great marketers can do both.
Yeah.
Cost efficient.
Yeah, excellent. Well, we'll get into a little more of that in a bit. Right now, we're going to take a break. I'm speaking with Elliot Berger. He's got a wealth of experience in the life sciences space with Johnson & Johnson, Ernst & Young, and culminating, well, maybe not culminating because you're off doing great things now, but he also served as a chief marketing officer at Catalent. We'll be right back. We're back with my guest, Elliot Berger, a true trailblazer. He's got an incredible amount of experience in the life sciences industry and marketing, and doing some really innovative things with Ernst & Young, Johnson & Johnson, and Catalent when he was the chief marketing officer. And now he works independently as a fractional marketing chief marketing officer. We're going to talk a little bit about that. But Elliot, I want to understand, I want you to share the secret sauce of success as a chief marketing officer. I imagine just about every, mid-level, maybe even junior marketer out there kind of sees themselves as being a CMO. So if you would like to talk about that, like, how do you define the role? How has it changed over the time you've been in those roles? And one of the things, like, how did you interface with the CEO? Because at Catalent, you had a great relationship with the CEO. How did that work?
Luck. Luck. So in this particular industry, I come from Johnson & Johnson. I was in a consumer group of companies, which is a great, almost academy marketing company. There's a lot of marketing. Let's just say in any year, in the last couple of years, they spend more money than this entire industry spends in a year. And there's a lot of great marketers, a lot of great agencies, and marketing is kind of the lead function almost. In this industry, unfortunately, it isn't. And the first advice to marketers is, as they're dealing with C-suite, is to understand the strategy and make yourself an indispensable part of making that strategy, right? Oftentimes marketing doesn't get there, but marketing really is where the knowledge of the market gets marketing, and the knowledge of the customer resides deeply, and should be the home of product management. It should be the home of customer insights, and is a culmination of a lot of the strategic planning processes they go to market. Even if they're executed through the sales force, it's still typically structured, and organized, and messaged by marketing. So first, get involved in the strategic planning process, showcase your knowledge of the market, the competitor, the trends, the expertise, the customers, right? Technologies. That's very important. And then secondly, position yourself as the key executor of the strategy that is vital to making stuff happen. There's always this debate, execution of marketing, marketing eats execution, execution eats strategy, right? Well, nonsense, as most two-sided debates usually are. It's both. You don't have a strategy, you can't execute. If you don't have execution, your strategy is useless. You got to have both. So marketing has to be a part of making the strategy, and then a key part in executing the strategy, communicating the strategy, driving the sales strategy, driving the product strategy, driving the messaging to the right side of the right consumers in the right segment, which is a lot of the output of the strategic planning. That's very important. And then, you have to have rigor, and you have to have KPIs, and you have to adopt the same type of rigor and the same type of language and the same type of approach as the rest of the company. The rest of the company is very, very KPI driven. So are you. If the rest of the company is driven by a few key KPIs and more anecdotal or case study approaches, so are you. You have to be in that mode, and you have to be with everybody. And the last thing in this industry, you have to be really close to your sales team, and you have to set up proper boundaries where, I like to say we help figure out what the strategy is, and then, they have some input into marketing, and then we support them. I always say in the B2C space, the marketing team is on the field playing, and the sales team is in the ticket booth selling tickets to Walmart. In the B2B space, the sales team is on the field playing, and the marketing team is standing on the sidelines yelling that way, right?
Yeah.
Trying to call the plays with variable success, right? So, the friction happens with the sales team in the B2B space, and you have to make sure they understand where they're going. They appreciate the data and the targeting you provide. They appreciate the collateral you provide, and you support them in every way. There's always a little bit of back and forth, as it's supposed to be between functions. That's what excellence is for, and the functions are for. But that is the last element. So the strategy involvement, the strategy execution, the KPI and operating rhythm, and a really tight connection with the sales team.
Well, that's excellent evergreen advice. I mean, that really is are the basics. So hard to do, but
easier said than done. I have to speak everybody's language. When I first came to Catalent, I talked about the blueprint for marketing because it's an engineering company, right? The marketing infrastructure. Why marketing infrastructure? Because everybody knows infrastructure is not cheap. It takes a while. It needs to be planned out, right? And I talked about the science of marketing, scientific company, right? They said, look, there is a certain math to marketing. You need to know who you're seeing, how much they're seeing it, what the number of the audience. You have to multiply across your various response levels. Just like a pipeline, success factors by stage, you need to understand your marketing and sales pipeline, success by phase. You talk about the same language as everyone else, and you explain that, a clinical trial costs $100 million. You cannot do it for less than $100 million. A marketing campaign costs $1 million. And if you try to do it for less than that, you can do the same thing as you try to do a clinical study on a shoestring, and then you don't have enough power, enough patience, and then it's useless, right? The same. So, marketers are really good about marketing externally. They totally forget that when they're talking internally, it's the same thing. You have to explain it in the right terms to the right audience at the right time, just enough times. And we go get frustrated. So I told them. I said, well, you told them once. I said, so? I said, well, how many times do you need to tell an average consumer before they remember? Like 7 or 8. I said, well, think of your sales team as your customer. How many times you tell them, sales team between us, maybe 12, right? Maybe in smaller pieces.
Yeah.
Just kidding, sales
Such
guys out.
That's
But
so important.
the same.
I'm really glad you brought up that internal audience and the messaging to them. That's so good. What a key takeaway that is. So one of the common things I hear is the friction between marketing and sales, which you mentioned, and you talked about boundaries and some rules of engagement. Maybe what are some examples that you employed at Catalent that worked real well?
Well, I was really, really fortunate in a way that our chief commercial officer that I worked with most of my years there, who's since then made a great CEO in a couple of places. I'm still waiting for him to get a big enough CEO job to hire me again. You know who you are, get it. Came from big pharma and understood what the difference between sales and marketing capabilities are, right? In this industry, sometimes you see a lot of people who are the heads of sales and marketing, but they're really lifelong sales professionals and don't quite understand the other side of the coin. They need to hire a competent marketer and trust them to execute the science of marketing because it's different, it needs to be done differently, and it has its own rhythm. So thankfully, I've always understood. I always had somebody who, not always, but at that point for a long time, had somebody who understood that. And we set up a thing that, that worked, where the system was the marketing team is responsible for identifying the direction that's coming out of the strategic plan for the type of segments and the type of propositions and the type of thing that need to be sold in consultation with the sales team, but setting it all up, setting up the messaging and the collateral and communications and the lead generation approaches. And the sales team is responsible for driving what they do best is driving the sale, right? And listening to the customer, delivering that messaging, tailoring that messaging, and always be closing, right? We say, look, if you know who the customer is, Johnson and Johnson, right? You don't need me, go buy 127 dinners, which is probably what it takes at Johnson and Johnson to close the deal, and close the deal. If you don't know who the customer is, because right now in the industry is what 90% of the pipeline is small biotech, then you need them to come to you because you can't possibly have that many dinners without the need for Vigovi. Then it's marketing, right? You have to go beat the drum, beat that, lead generation and bring them to you with a mindset, oh, I got to talk to these guys.
Yeah.
And then it's a little bit easier. You have to close the deal. So you have to have these roles. You have to have close collaboration. Marketing goes on sales calls. Sales team reports all the news and findings to marketing, and they work in that collaboration. But marketing is demand generation. Marketing is messaging generation. Marketing is branding and creating that umbrella and getting that buyer soften up for you. And sales is closing, negotiating, and as I always tell them, at the end of every meeting, okay, go away and sell something.
Yeah, yeah. You mentioned a couple times already the importance of understanding what problem the client has, the prospect has, that you can solve, and understanding what that is. And, I don't want to be overly critical, but when I see messaging out there, I rarely run across that people are projecting that very well. How did you manage to get that accomplished?
Well, that's hard, right? Because in a lot of this space, we're providing a service. It's not like a beautiful iPhone product where all you have to do is show it and press some buttons and everybody goes, wow, right? Or the new headset or whatever you call it. It's a service. And a lot of the same attributes apply, and the reliability and the expertise and the capability and the capacity. And a lot of, it's difficult. But as I always told my team and Adam, I don't pay you for easy. I can do easy myself, right? I can hire a couple of people and do easy. Nowadays, I can go to ChatGPT and do easy, right? So you have to dig deeper and you have to find out what your real source of differentiation are. You got to do your voice of customer research, your market research. I always had my guru on that, and so I'm very keen to draw it out. And people in this industry too often take the easy route, what I call marketing by Russian roulette. which is death by bullet point, just throw it all out, right?
Yeah. Yeah.
Or putting on like equipment pictures. I'm like, it's not your equipment. You bought it. Everybody can buy it. They have the same equipment. Or they put, a bunch of people in white coats that don't even work for them. And they're like, okay, everybody's got it, right? So you always have to come up with something that's special about your brand, special about your company, special about your execution. It doesn't have to be completely unique, but it has to be different. And it has to be something others are not talking about. And that's hard. And it's creative. And you need good agency people. You need good market research. You need thoughtful marketers. You need to keep asking the question, why is that important to us? Well, why is that important? Because you have to, after you ask why the fifth time, and if everybody's stumped, you go, oh, okay, now we're getting somewhere.
Yeah.
What is it? All right. And then people forget you can't market everything to everybody at the same time. It don't work. And it's difficult, particularly the bigger company like Catalent or a larger CDMO with multiple offerings. If you try to take the biggest generation, you end up with platitudes. You have to segment your audience and put the right message where that audience is and put a different message where the other audience is. And C-level people and the procurement people and the science people need different messaging.
Yeah.
Biologics and cell and gene and small molecule people need different messaging. They're different whys, but it has to be the part of the same brand, right?
Yeah.
Catalent was always around more products, better treatments, reliably supplied, taking advantage of our depth of technologies and offerings and capabilities. And some people wanted really better treatments, R&D, and some people wanted reliably supplied, procurement. And some people wanted more products, executives, like, okay, the more products I get, the bigger my pipeline is, the better I'm going to do. And then, but we never marketed it like as such. We marketed in pieces very, very specifically and tried to be really creative.
Yeah, thank you for all of that. That's really excellent advice. I think it's not one size fits all. That's really good. And I go back to something, as you were describing that process, something you said earlier, good and relevant. It fits into that bucket. All right. So awesome stuff. I have another question so if you could think back to, like the first day, well, maybe not the first day, when you first became the chief marketing officer at Catalent, what surprised you? What happened, or what did you have to do that you didn't expect?
Well, I do remember that. I still, it's funny, I was advising a new head of marketing and a new CDMO just literally a few weeks ago in my new capacity, right, as an advisor, and, as a fractional chief marketing officer, or as a director of a marketing agency, that I have one of my roles. And I said, welcome back to 1999. And she was laughing, and she got it because she's also from consumer space. The CDMO marketing is literally not at the forefront, as you might imagine, of marketing out there. In consumer spaces or in larger spaces with much larger budgets and much larger audiences, you can get pretty damn sophisticated these days, right? You can buy TV ads and households that just have babies. You can, buy ads to people who just went and Googled your product. You can do all kinds of very sophisticated things, and you can have Kim Kardashian endorse your product, right? There's all kinds of very, very clever things you can do if you've got the money and the power to do so. The challenge in the CDMO industry is, how do you adapt those leading practices at the budget and the subject matter that you've got? And it's challenging, and you've got to get, more creative. To your earlier kind of question, what's different about CMO these days? Well, you're no longer just a CMO. You're kind of like an editor-in-chief. And the inside sales leader-in-chief. And data scientist-in-chief, because marketing is no longer what it used to be, where you could, the good old days from Mad Men, go look at that TV show. If you're a marketer, you must have seen it. If you not, go watch it and don't tell anybody you haven't. it's all about the creativity and the budget and the TV and some glossy print ads, and it's like the mass of it.
Yeah.
Now, increasingly so, you got to create your own content, and the content's got to be interesting to your particular sub-niche audiences. In this space, it's really boring, scientific content. I didn't say boring. Um, and where you place it, and you have to work around everybody's confidentiality, and then you have to, use the digital tools that are available for audience portrait generation that's available in the B2C isn't quite available. And you got to play all these hats in between data and the digital and the content and the creativity and all that to almost like I always, the marketer in chief, as well as a CDMO sometimes itself, is an orchestra conductor. You got to conduct, a project manager. You got to conduct all of that stuff with the added challenge of creativity overlapping it all. And that's hard. And that's why there isn't a lot of great marketing in this industry, because there isn't just not enough budgets or experience or recognition on the C-level suite that you needed, which is partially why I'm doing this fractional chief marketing thing for a couple of different people at a time, where they just don't have enough scope and experience on the budget to do that. And either don't have a marketing team, have more of an executional marketing team that needs, that level of oomph.
Yeah.
And that's why I, joined the board of directors of Orientation Marketing, which is a marketing agency where, we try to accumulate the power of our customers to be able to rival Catalent and big CDMOs in the more creative and more breakthrough media buys, or bringing the right level of talent for creative or digital or other execution.
Yeah.
And that's also difficult because a lot of the agencies in this space are kind of, smaller B2B players that have never seen anything.
Right.
When I first came to Catalent, I brought with me my consumer agency, and we had to inside write all the copy because it was very scientific, but they did all this totally different visual stuff that wasn't done back then. I'm afraid we've poisoned the industry with all the icons. It's now degenerated into high school level clip art, I'm afraid, from poor copying. But you have to bring in different talent and try different things. And, if you haven't seen it, it's hard. And if you come from a much bigger strategy and marketing arena, you've seen it, you know how to do it. It's just an art of adapting it at the budget that you got.
Yeah. So you mentioned fractional CMO. You're doing that now. You talked a little bit about it. Can you expand on that? Like, how do we define that? It hasn't been around for all of history. There seems to be more fractional CMOs now, and almost more importantly, like, what kind of company, what kind of challenges or conditions are they facing that would be right for fractional CMOs?
Well, good question. So, look, this is all the gig economy, right? So there's a lot more, not just fractional CMOs. I've seen fractional CFOs and fractional heads of HR and, things of that nature. You need a CEO, somebody needs to be in charge. And then CDMO, you probably need your own head of sales. And then to an extent, others, despite the proliferation of titles, it depends. Marketing being less of a recognized core function in this space, unfortunately, is thus more suited to that, right? So if you are a smaller CDMO or life science tools company or, anything in our industry, and you are not super large, you probably have your head of sales and one or two marketers who tend to be really busy executing trade shows and trying to run around the sales force and make sure that they are supported. They don't have the budget to have a full-blown CMO of, a certain caliber, and they don't have enough budget to hire the right creative agency or the right media buys, right? or they don't have a marketing team altogether and they use an agency,
Yeah.
which is a dangerous undertaking because you need to have somebody minding the store from the inside
Mm.
that understands the company, the culture, the management, and the strategy, most importantly, not just execute things at
Yeah.
random. So those kinds of companies could come to a fractional CMO like me and say, look, can you help us challenge our strategy to make sure it's properly connected to our communication goals? Can you help us craft a communication strategy and create a marketing plan that takes this company to the next level? Can you oversee our agencies that do it to make sure that they stay on strategy and they produce high quality stuff and they don't waste our money and they're producing the right content and the creative is up to snuff and that you're targeting the right people at the right place and the right time and what we talked about earlier is the most difficult part. Did you get the right differentiation, the messaging and the segmentation correctly versus you kind of trying to do sales talking points to everybody all at once at the same time, right?
Yeah.
And those are the things I can help with on a fractional basis. You don't need to pay me a full level of salary like Catalent would for 80 hours a week to execute because you don't have the Catalent 60 sites and 27 different lines of business.
Right.
And we can structure the right agency support and then, eventually hire you more senior marketers. And eventually you don't need great.
Yeah.
That means you've been successful properly enough and they can stay an advisor or whatever or go.
Yeah.
But, in the beginning at the stage where you need to take the next stage of growth beyond, I have enough friends and family I'm selling to and my two sales guys are too busy, to, okay, no, I need to step it up, where I've been acquired by PE, where I just got this investment, where I need to get this investment, where I just finished a new factory, I need to get into the space when you need marketing and more leads and a better brand and be well known and be an attractive target or be an attractive partner. That's when I would come.
Yeah. Great explanation. Thank you. And I've never asked that of anybody. I made a lot of assumptions, but that's a great explanation. I feel much better equipped now when I'm talking about it. I want to ask about media buying. So the media companies out there in the life sciences space, some of them look just like they looked in 1980. And other ones are modern technology companies and don't look anything like a traditional media company. How did you approach media buying? How do you?
That's interesting. It's one of my favorite things in marketing because, and then most marketers don't pay as much attention because it isn't, it's a different thing. There's a lot of math involved. But even at J&J, I was in charge of a lot of media buying for a very big brand, the tunes of hundreds of millions of dollars. And I was always fascinated by it because that's where you spend the vast majority of your money if you're doing it right.
Mm-hmm.
And it is extremely easy to waste it.
Yeah.
Right? It's one of the key important things for CMOs. The CMOs want to never be over budget. You can argue about your budget. You can always ask for more budget. You always fight for your budget, but never be over budget. Because when you're over budget, the finance and the CEO will never trust you again. And that's a death trap. Mm-hmm. So fight for it, but then never spend a single dollar more. Never spend a single dollar less either. So I always approach media buying as one, what's on strategy? Two, who am I trying to reach? And the fact that all of the people you want to reach are in there is not sufficient. Because if they're 5% of that total audience, you're by definition wasting 95% of your dollars.
Yeah.
So if you pay somebody double, but it's 80% of the audience, in fact, per person, you're much cheaper. The other thing people don't understand is, I was a strategy consultant to digital startups, so I understand how that works from the inside in the economics. Don't settle for the rate card and what's on the rate card, because the media companies are also guessing at what they want. They create products and they're saying, okay, here's what they've got. That doesn't mean that they can do 27 other things, right? if you ask them and if they thought about it and if you offer them a proper incentive. All right. I was always, our partnership with you when I was at Catalent, nobody ever sold me until you came up and I told you exactly what I needed and you made it happen. After that, we spent a lot of money with you guys, right? Over time. And the same thing happened to the other audiences and some of these. I helped start some of the bigger media players that are now big in the space because I would fund them early and I would fund them often if they created what I thought was missing in the space. Because you have to recreate the things that exist in the B2C space where you don't necessarily need to make them. You can buy them in pieces and put them together. Here you need to sometimes make it, find something that's good for the audience. So right now I work with some of the leading media companies to craft some things that are specific to the customers I have and then exclusively fill it with my customers. And, then they can have the level of presence and breakthroughs Catalent could have on their own, leveraging the budget, but in a very specific way. Or we try to create something that doesn't exist. And then, get my customers involved, and then it's all extra to the media company. And the other thing, you always have to think the math, right? Majority of the things are now digital, but even in non-digital, you have to say, okay, does this method that is being proposed have a realistic chance of achieving my objective mathematically? If my goal is podcast views, how many people do I have to expose to the invitation to see the podcast so they would click on the landing page, read about the podcast, read the podcast and listen to it enough time that you consider it accomplished? Well, the math is increasingly fractional. And you sometimes say, oh, I need 1 million people, but you're not getting 1 million people, you're getting 3,000 on this list. So if you advertise it to 3,000 people, but you need 1,000 in the end, you're never going to have. No matter what price it is. Then the second thing is a lot of marketing these days are labor intensive, it's a lot of effort. So, okay, if I have that math plus all that effort, do I have a payoff? I have to really think that through as opposed to go, oh, my budget is X, these 3 things fit, right? So it's always very important to do your math, to be creative, to work with the media companies and to find an agency that can help you do things and aggregate things that you can't do on your own.
How about measuring results? How much do you rely on media company to deliver results besides, what you're landing sales, sales are increasing, or if you had a growth objective that's happening. But what about all the other eaches? Like, are you reaching the right people with the right equation, the math equation that you're talking about?
That's a great question. I think the most important bit is to know your objective, right? And people go ROI, and ROI in this space is extremely difficult. The systems are kind of obsolete. By the time you bring in a lead, did the salespeople do this? Did they open a new opportunity? Did they lose the attribution? It's just very difficult. Other than the ROI of a customer who doesn't know who you are, very. Now, you have to lay out a series of corresponding metrics like the sales team has in their funnel. Because a great sales leader will tell you, look, if I need to sell 3 deals, I need to talk to 27 customers, or 32 customers, or 63 customers. They know their funnel and all it takes. Or I need to sell $100 million, I need to have $1 billion in the funnel, or whatever that is. They know. Marketing team needs to know the same. So if I want 10% market share in my strat plan, and my awareness level is 5, am I getting 10% market share? Never. If people don't know, 10% of people know who you are, unless you sold several very, 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 very big deals, not getting, right? So if you say, I want to be the leader and your awareness level is 12, 17, you're not the leader, right? You need to be in the 30s. Or at Catalent, we started at 3 and we ended up with 75, right? And it took 10 years and a lot of dollars, right? So if you need to know your awareness. From that, you need to know, okay, your friend Andrew at Industry Standard Research, right? One of the questions they asked, I always pay attention to, is, do you have an intention of showing your RFP next year to these customers.
Yeah.
So basically a prediction of purchase intent and deal flow, right? That is going to be lower than your awareness level, but got to be higher than your market share because that's how it's going to grow, right? So if you're doing an annual research of voice of customer, which I highly recommend, you must do it, right? And that's your key KPI. Did my brand improve? Did my awareness improve? Did my purchase interest improve? Per business line, per business unit, per region, whatever it is that you need. Did my awareness go up? Did my credibility go up? Do they know who I am? Not just heard of me. Am I on an RFP list? Right? And then you go all the way down to lead generation. Lead generation is important. And some people love to do branding and some people like to do lead generation. A great marketer has to be able to do both on the same budget.
Yeah, of course. Yeah.
That's right. So it's like you want a cake, but you need vegetables. You got to work the meal, right? So you have to have enough. I always said, look, it's very hard to generate because a full sales picture, because the initial new customers that marketing breeds is always the smallest purchase they're trying is a feasibility study or it's a kind of an initial trial or whatever. And it's very hard to track what they buy afterwards. And it's very easy to lose half the deals in the process. But ideally, you can show enough deals that came from marketing, the first contact into the CRM is marketing, that you've sold enough deal to cover your marketing. In which case, you can always tell the CFO, but you're not losing anything because just the stuff I can see covers or close to covers.
Yeah.
And it's not, it's not unreasonable to say, look, what you see is only 10% of what there actually is, because the first deal is usually the smallest, and because you usually lose 2/3 of the stuff in the process because they looked at your webinar, they looked at your email, and they came up to somebody at the trade show, and then they did the business. So sales guys go, I just found them at the trade show. Okay, yes, you did, but so a lead generation talk is much harder. But if you can trace enough case studies of enough large deals and enough flow that goes from marketing into inside sales, from website into inside sales, from trade shows into inside sales, and then you record it, and then there is, enough to cover your marketing budget to close there too, or more than that, that is also important. And, you need to feed all of that into your sales BD funnel, because the sales has a funnel and you're right above that funnel on the top of that. So you have to feed enough into it so the sales guys go, okay, there is enough of that coming into for half or a third of my stuff and I'm going to get the rest, but there's enough moving. If they don't feel there's enough movement, there's going to be a constant thorn in your neck, in your side. If they feel like there's too much, great. You just need to tighten it up a little bit and handle the higher value, the higher, the earlier stage purchasing ahead and give them later. But that's to my earlier point. You have to be connected to the sales team.
Yeah.
So, summary, you have to have your awareness marketing, you have to have your credibility metrics, you have to have your engagement metrics, you have to have your lead generation metrics, you have to have your purchase intent metrics, and the brand strength. Who is the leader in the space? If you want to be the leader and you're not in the top 3, top 5, unaided, you're not a leader.
Yeah.
I often laugh at companies whose first line, such and such, and leader and such and such. I'm like, I've never heard of you. You're definitely not a leader. You're not the leader. You're not a leader. It's much better to not blow smoke up everybody's face and say, I'm the best-in-class specialist in. People go, oh, okay. If I need that, I'll talk to you. Versus I am a leader and everybody asks, who are you? Right?
Yeah.
And then so the brand strength year on year on year, credibility, reputation, referrals, recommendations is all very important. So there's a lot of statistics. The good news is, as a marketer, if you're doing your job well, there'll be enough of them every year in a positive territory to earn you a bonus.
Yeah. Excellent. What great advice. I love your candid, pragmatic, practical approach to everything, Elliot. Just good stuff.
Enough complexity in the world to add more to it.
Say that again?
Too much complexity in the world already. Why add? Simplify.
Yeah, that's the trick. Great. That's what right looks like. No surprise that things went well for Catalent when you were there. So, one final question. So, you're in front of an audience of younger folks who are in marketing, and they kind of think this is probably their life's work. What advice would you give them?
Yeah, it's more complicated now than it used to be, where you just go back, 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 back over time if you're good, right? So the way I thought about it throughout my career is, you talk to some people, you watch your bosses, you paint in your head, what skills do you really need to succeed? Okay. And it could be marketing skills, technical skills, data skills, digital skills, whatever. You can make a list out there. It's not complicated. There's also some actual lists, actual management and people skills that you really need as much, if not more sometimes. One of my favorite books, What Got You Here Won't Get You There,
Yeah.
right? Because when you're doing your work yourself, versus you're trying to get everyone else to do your work and orchestrate lots of things, it's different. So make a list of all of those skills and ask around, get a mentor, and then say, okay, I need to get these skills. Then don't hang up on which order you're getting these things in, because you need to get them in some order. And sometimes it's going to be painful. Like if you want to be the head of sales and marketing, you got to do sales at some point.
Yeah.
I've always resisted it, and I've done it on occasion, but I never really enjoyed it. I was good at it, I just don't like it, right? But you have to take the pain once in a while. So try to pick, whatever is the best opportunity to learn the most of these skills in an environment that you will enjoy, and do that. Once you learn it, it goes, okay, check, check, check. What else is missing? And then go do something else that does that. The order isn't quite so important as long
Yeah.
as you keep going up and your title goes a little bit and your base salary goes a little bit that way, right? So that's really important. The other thing is, is a relationship. The people who do the best careers usually have mentors and sponsors and other executives in other fields that's kind of like drag you along, and but it's not sufficient, because once in a while you go, oops, where did everybody go? People get promoted, people get retired, people leave, and you go, oops, right? So but it's always helpful, mentors and sponsors, and kind of, be outgoing, talk to people,
Hmm.
don't run home at 5 o'clock, do the team bonding, find out if people, get advice.
Yeah.
And the final thing I'd say, which is not something I would have said even last year probably, is nowadays you gotta do better than ChatGPT can,
Oh,
right? AI is coming for you.
yeah.
It can do copywriting, it can do creative with 6 fingers once in a while, but
Uh,
still, and it's going to get better and better and better, and it's probably going to get better faster than you will.
Yeah.
So think about what do these things cannot do, right? They cannot put things together.
Yeah.
They cannot understand the strategy and drive insight. They cannot talk to customers and figure out what's going on. They can't come up with a creative campaign that is on strategy that is in a certain kind of way. It's those integrative, creative, higher level skills that you need to both outrun ChatGPT and become the chief marketing officer.
Yeah. Excellent, excellent advice. That's really good. You've really put some thought into that. And yeah, Chat GPT's coming for us all. Huh?
It does, right? Soon enough it's going to be able to do interviews.
Uh,
So, the good thing for you and me is we're at a point in our career that probably won't catch up with us.
exactly.
But if you're in mid-20s, I was speaking to a close friend who's a big IT executive, and son is a software developer. I said, you're old, man, so you're good, probably. They're not going to do systems architecture and the things you can do. But it's coming for your kid, and you got to worry about it, because I think it's going to code. You're like, no, I don't believe it. I'm like, I will talk to you 3 years from now.
Yeah.
Because, it can write full websites right now. And it's like way, way better than most do. And then you can just spend 10% of the time fixing it and improving it and so on. But you have to outrun it. And you have to be human. And you have to be creative.
Yeah. Great stuff. My guest today, my trailblazing guest, has been Elliot Berger. He has had a lifetime of experience in life sciences marketing and sales. Time with Ernst & Young, Johnson & Johnson, Chief Marketing Officer at Catalent. Elliot is now with Orientation Marketing and also Expert Insights. He serves as a fractional CMO for a number of organizations. And with all his experience, he can advise you on an endless number of things.